Well, the 2025 meeting of the Menopause Society, it happened last week in Florida. This small event, it pulls together doctors, nurses, researchers, basically all professional groups involved in conducting studies and exploring new insights in menopause and midlife health. One major point of discussion, the connection between hormones and heart health. KSL medical contributor Phil Cowley is joining us right now to break this down for us. But let's just go back a little bit and kind of give us some context here as far as what was the messaging 20 plus years ago to where we are now.
So 20 years ago, there came out a study. It was called the Women's Health Initiative, which really they should rename it because it didn't help any women at all. But what they did is they found out that there was this link to higher levels of clotting at that point. And so what had happened is you turned 60, you were done, no more hormones. They kind of kicked you out the door and said, well, good luck shriveling up all by yourself. So.
Wow, so now we have this new information here, but how did that affect women? I mean, that's pretty...
So at the time, about 26% of all women were on hormone replacement. So this was from any age from the time of 10 years before menopause all the way up to the time that they passed on. And it went from 26% down to 4%. So that means all of those symptoms, all those terrible things they were going through, kind of hit them like a brick wall. I remember sitting in the pharmacy and woman after woman would come in and say, are you sure that this was dangerous? Because they had so many symptoms they just did not want to have to live with, and they felt like it wasn't, they were listening to their body. Like, this just doesn't feel right. So
there were some unintended consequences as a result of this.
Yeah, and you know, they had some data, but the data wasn't really well defined. And that's really what comes down to it is that it takes 20 years for us to really define data, and that's what we found out on this last conference.
Yeah, so let's go ahead and fast forward to that. How has the conversation shifted now?
So now we look at it, and instead of looking at it as being a negative thing, they started breaking it down into groups. We found that really the cancer risks they were looking at weren't really what the cancer risks seemed to be with initially. They also saw that timing was so important, and we found that symptoms of what women go through when it comes to menopause aren't just symptoms, but they're underlying conditions that are getting worse.
That is really insightful. So what does that current research tell us about cardiovascular health and then the hormone therapy specifically in the link?
So estrogen is so important in keeping your veins and arteries so they can move, they stretch, and you also see a huge change when estrogen disappears in the amount of cholesterol they have. These are both huge markers on keeping your cardiovascular system healthy. So if we start hormone therapy at the right time, we find that the heart is protected. They have less strokes, less heart attacks, and less dementia risks.
And that was really the point of discussion at that meeting, is the timing of it all. Can you dive in a little bit deeper for that?
It's important that you jump into it early. When you first start getting hot flashes, when you first start getting brain fog, when you start having, you have to start it early. First 10 years are so important. If you go through the desert of no estrogen for 10 years and then start it, well, then when we stretch out everything in there, you start having higher clotting risk. So it's important to start early, and then you can stay on it for as long as it's safe with your doctor. And instead of having a hard cutoff date, it's all about where are your symptoms at, how are you feeling, and talking to your doctor.
Yeah, and what are you hoping that people, women specifically, learn from all of this new information?
Oh, listen to your body. They were right back in the 2000s. Yeah. So if you feel like there's something wrong and you don't like the way you feel and you're like, this is terrible, go talk to your doctor, because the data does support those aren't just symptoms. The more that you take your health in your own hands and saying, I don't want to feel like this, how do we fix it? It actually shows you live longer, better, and it protects your brain.
All right, Phil, how can we get more information about this?
You can look any place on Phil's My Pharmacist. You can find me all over the place, and obviously always talk to your own doctor and healthcare professional.
All right, thanks so much for the information. We appreciate it.
Thank you.